A new report identifies the urgent need to focus on mental and behavioral health needs of women and children in the U.S. Dr. Rhonda Randall from United Healthcare joins us to talk about what the health report reveals about Missouri and Kansas.
It looks at over 114 measures of our health from 35 different public health sources. It looks at women of reproductive age and children under the age of 18. Those two populations make up 40% of the population of the United States.
What are the health strengths of Missouri and Kansas? Can you elaborate?
When we look at these, they're rankings. So 1 on the list is the highest in the nation and 50th is the most challenged. Kansas is ranked 6th in the nation for a low amount of drug use among youth, ranked 9th in the nation for prenatal care, 10th for babies who are exclusively breastfed for the first 6 months of life, and 6th in the nation for the number of children who are getting physical activity. Those are the strengths that we see in the state of Kansas.
And what about Missouri?
So for Missouri, for strengths, we see high rates of high school graduation. Missouri's ranked 9th in the nation for that measure, 7th in the nation for the number of licensed pediatricians in the state, a low rate of severe housing problems. These are people who have housing, but that housing might not be adequate. 10th in the nation for Missouri, and children are getting physical activity also in the neighboring state of Missouri, 11th in the nation for that measure.
Now, what are the health weaknesses of Missouri and Kansas?
So both states, as well as all 50 states in our nation, have their challenges. For Kansas, some of the notable ones, although we said that drug use among youth was a strength, alcohol use among the youth is a challenge, ranked 38th in the nation for having a high rate of alcohol use among youth. High rates of childhood asthma as well. Kansas is ranked 40th in the nation for that measure. For women's health providers, state of Kansas is ranked 43rd. And for children who are getting access to a WIC benefit, that's the Supplemental Nutritional Assistance Program for women, infants, and children, ranked 41st in the nation there. These are children who qualify for the program but aren't signed up for it. And then women who have multiple chronic conditions is ranked 36th for Kansas. For Missouri, the news is really around smoking among women, 47th in the nation for the number of women who smoke. And that also bleeds over into women who are smoking during pregnancy and children who are exposed to household smoke. We see a low rate of women exercising in Missouri, ranked 48th in the nation for that measure. Childhood mortality, an important metric. This is looking at children who are dying between the ages of 1 and 19, ranked 44th in the nation there. That measure ties very strongly to things like teen suicide, for example. And then women with multiple chronic conditions is also high in Missouri, as it is in the neighboring state of Kansas. In Missouri, women who have multiple chronic conditions, this is 3 or more chronic conditions, is 41 in the nation.
Last question, will there be a report now just talking pure pandemic numbers?
So we release the reports several times a year. The next one to come out is a month from now. That's the annual report. It looks across all ages. That will start to have some pandemic data in it up to 2020. This Health of Women and Children report was the first time that we started to get a look at some early measures like anxiety in children. We saw that go up. In the report of Women and Children, that included the year 2020. The other reports that we release throughout the year are the health of seniors, that comes out in May, and the health of those who have served in the U.S. military. This summer, we also released a report specific about healthcare disparities. So we'll start to see this December more pandemic data coming into the annual report.
For more information on addressing the mental and behavioral health needs discussed, just go to uhc.com, where you can also get more health and wellness tips.